Hello everyone, welcome to Tamali's classes. In this class, I'll be talking to you about menstrual cycle, and in this class, I will also talk to you about ovulation in pregnancy, which also is a very important part that leads to this menstrual cycle. So this topic is not just important for CSI and life science students, but also students who are having the NCRT syllabus, even in biology subject, they also have this topic of menstrual cycle and also about the ovulation and about the other topics like menarche, menopause, all linked to this. So it's a very important topic. So let's start with today's class. Okay. So first of all, my first slide, I'll talk to you about what is menstruation, menarche, and menopause. So before we get into the menstrual cycle, first we should know what is menstruation. What is it about? So menstruation is basically it's a vaginal bleeding. So it occurs every month, once in every month. Sometimes it might occur more than once, but basically it occurs once in a month in all women. So what happens is that it is a part of a woman's monthly cycle. And when does it happen? So when a woman does not become pregnant, when there is no pregnancy occurring, or you can say when there is no fertilization occurring of the egg, then what happens? The uterus or the womb, it will shed its lining of endometrium, which we will get to know in my future slides. So when this happens, when there is a rupture of the endometrium lining, the rupture of the follicles out there, what happens? There's a blood discharge from the vagina, and this blood is known as the menstrual blood. It is partly blood and partly tissues. So now, what is menarche and menopause? So the first periods, this menstruation is also known as, some call it as mens, some call it as period. So the first period is also known as the menarche, and it might occur in the age, it might occur as early as 10 years or 11, 12, 13 years. It depends on different women have they get this periods in different ages. So, and menopause is the last period. Okay, the first period is menarche, and the last period, which usually occurs at the age of 40 or above 40 to 50 years. So that's called menopause. Okay, let's move on to the next slide. Now, what is ovulation in pregnancy? Now, I'll just tell you a bit of details of what is this. So, ovulation. So, what is the meaning of ovulation? So, the release of egg. Okay, release of egg from the ovary is known as ovulation. So if you look at the diagram out here, this is the fallopian tube, okay, and this is the ovary. You can see. So this ovary, what it does is it releases egg into this um into the fallopian tube. Okay, so ovary will release egg, which will move on to the fallopian tube and wait there for a sperm to come and fertilize the egg. Okay, so basically, ovulation is the release of egg from the ovary. That is the ovulation. Now, I have mentioned earlier ovulation and pregnancy. Why I have told here is that during this period, okay, during the period of ovulation, that's the perfect time, uh, like for pregnancy to occur. So if couples are planning, uh, to for a child, or if women want to get pregnant, this is the perfect time. This ovulation is the perfect time when they can try for pregnancy. Why? Because the egg is released in the fallopian tube and it is ready to get fertilized by the sperm. This is ovulation, this is pregnancy. Now, sometimes what happens, the pregnancy does not occur. That means the egg is not fertilized by the sperm. So when the egg is not fertilized by the sperm, then what happens leads to the menstrual cycle. So we'll talk about it. So just look at this below diagram out here. Okay, let's talk about this diagram first. So just look at the structure. So this is the structure of the female reproductive part. So fallopian tube, I've told you, this is a tube which connects the main uterus with the ovary out here. So ovary releases egg out here, egg is released and it stays here waiting for the sperm. This is the endometrium lining. Okay, the lining is present out here in the uterus, and which during the time of fertilization or when the egg is waiting to be fertilized, endometrium gets ready. The vessels, the blood vessels, they are filled with blood, and the linings are produced out here. Follicles are there; they are growing. They're getting ready to receive the fertilized egg out here in this part. Okay. So the myometrium is the internal part out here, and the outside is the endometrium lining, which we say, and this is the vagina part through which sperm enters and moves on to the fallopian tube to fertilize the egg. Now coming to the lower diagram, see the diagram out here. In this diagram, I have shown you the menstrual cycle. So basically, menstrual cycle is of 28 days. In a woman, 28 days is the menstrual cycle period. But in some, depending on ages and in some women, this menstrual cycle might differ. The days might differ. Some might have 45 days, some might have 23 days, some might have 25 days, some might have 28 days. But generally, it's 28 days. We take it as 28 days of menstrual cycle. Now, in this menstrual cycle, you can see out here the first day of the cycle, okay? The first day. From the first till the seventh day, during which the menstruation occurs. So sometimes it happens for 4 to 5 days. In some women, it can be more than 4 to 5 days. So the menstrual cycle, the first day of the menstrual cycle till the seventh day is the least fertile period. Okay? So because in this period menstruation is occurring, the shedding of the linings of endometrium and also blood is occurring. So that time the period is it's a very least fertile period, and couple should not opt for um, pregnancy or looking to plan for pregnancy during this period. Okay. Now after this 4 to 5 days or after this period of menstruation, the next 7 days, okay, from the 7th day till the 14th day, this is a very good time, or you can say it's a very fertile phase or fertile period for this pregnancy to occur, because in this period ovulation occurs. So the ovulation, this one, or you can see out here, ovulation occurs basically from 13 to 14 day. Okay, so you can see out here 10, 11, 12, 13, and 14. So this period is the best period because out here this is the period when ovulation occurs. It is also termed as ovulation window. Okay, this is the best chance for conceiving. Okay, so it's the best chance for conception. Now after the 14th day, the 15th and 16th day, there are very least chances. There are chances, but it is possible, but it's a bit lesser than those 10 to 14 days time. So before the 10 to days, before the 10 days, the 8 and 9 day, and after the 14 days, the 15, 16. So 8, 9, 15, 16 is okay. You can try, but the couples can try to conceive, but the best time is the 10 to 14. Okay, and then when the ovulation period is over, then we move on to the 17th day. Then the rest part, the 17th day till the 18th day, what happens is that couples are unlikely to conceive. Okay, women are unlikely to conceive because during that time, what happens? The lining, or as I said out here, the endometrium out here, this lining starts to thicken because it was waiting for the fertilized egg to come and get implanted in the endometrium area, and so that's why the endometrium lining thickens. Okay, that time what happens, if the fertilized egg does not come and implant, it will lead to the shedding of blood. Okay, so that is the very least expected time to conceive, or you can say uh, it's very unlikely that women might conceive in that period. So it's not a good time to conceive. Okay, so now moving on to the next slide, where I will talk to you about the menstrual cycle. So see out here the diagram. The first diagram we talk. See, out here the first day of the actual start, as I told you, in 28 days, the first day menstruation occurs, and then when menstruation occurs, the ovule starts to mature because it is getting ready to produce another egg. Okay, as I told, every month only one egg is being produced by the ovary. So during the menstruation, the ovary is already preparing itself to produce another egg. Okay, so ovary will start to mature, and during that, what happens is the inner lining of the uterus, they will get thicker. This part you can see, it will get thicker because as the ovule is preparing itself to mature and produce an egg, inner lining is getting ready to receive the fertilized egg. Okay, so then what happens? Then ovulation occurs. So basically, this age is also known as the follicular phase. Okay, so then we come to the ovulation phase. In ovulation phase, what happens? The ovulation occurs. Then next stage is the inner lining of the uterus continues to thicken. That means the rest part is called as the luteal phase. Okay, This is the follicular phase. This is the luteal phase. What happens out here is that this period the egg is being produced, and this period is getting ready to receive the fertilized egg. Okay, and in middle we have the ovulation period, and then you can say out here, if fertilization does not occur, the ovule dissolves. It's all occurring in the luteal phase out here. Okay, in the uh, uterine phase. We'll talk about it. The uterine cycle. At the end, you can see seventh point. You can see inner lining of uterus begins to slough off. That means when the fertilization does not occur and the fertilized egg is not being implanted in the lining, what happens? The ovule dissolves because it was not used. It dissolves, and slowly what happens? The inner lining of the uterus, which was thickened, it begins to slough off, or it begins to rupture. Okay, it gets ruptured. Okay, now look into the second diagram out here. So this all diagrams have been taken from the internet. So just for your convenience. So the menstrual cycle out here, you can see the first is the premenstrual part out here. That means before the menstruation occurs. And then we have the menstrual part when the menstruation occurs. And then the post-menstruation part when ovulation occurs. Okay. Look down, you can see in the premenstrual part, you can see out here the lining of the uterus, it starts to thicken. Okay. Then also the egg cell is being produced, which is getting ready to get fertilized in the fallopian tube. Then what happens in the menstrual part? You can see this part. The shedding of blood starts occurring because the fertilized egg has not been received. And in the end, you can see out here the post-menstrual or the ovulation part, where the ovary is getting ready to produce the egg into the fallopian tube, and this is again getting ready to receive the sperm and get the egg fertilized. Now we'll talk about the stages of menstrual cycle. So out here there are two stages. Okay, one is the ovarian stage and one is the uterine stage. We'll talk about it. So in both the stages there is the menstruation part, and then we have the follicular phase, then we have the ovulation phase, and then we have the luteal phase. So basically there are four phases in each cycle, in each stages of menstrual cycle. Two stages are there, ovarian and uterine, and in each stages there are again four phases: menstruation, follicular, ovulation, and we have luteal phase. So let's talk about it. So now we'll talk about the terms and phases, or we'll talk about the entire phases. Okay. So first is the ovarian cycle phase. As I've already told you, this is the part. Okay. Let me make it very clear to you, so that you don't have any confusion. So as I told, there are two stages: ovarian and uterine stage. Okay. So ovarian stage is the part where the egg is being produced. Okay. And uterine is that part where the egg is, where the uterine part is the uterine layer, the endometrium layer is getting ready to receive the fertilized egg. Okay, just remember these two stages. Okay, now let's talk about the phases that are present in this both the stages. So in ovarian cycle phase, what happens is that in this phase the follicles are being developed. Okay, so first we have the primordial follicle, which is having an immature egg. That means the egg is not yet matured, it's not yet ready. Then we have the primary follicle, and we have the secondary follicle, preantral and antral follicle. So out here, there's also a term known as graphene follicles, which are being produced out. What happens? This uh, in this stage, you can see here in the diagram out here. I'll show you the diagram. It will help you remember the process. So the ovarian cycle, if you see here, see the follicles are growing from an immature egg to a mature egg. Okay, the follicles out here growing, and then when the egg is mature, ovulation is occurring, and when the egg is not being fertilized, it forms the corpus luteum. Okay, you can see here corpus luteum, and slowly when it sheds off, corpus luteum turns into corpus albicans. Okay, now we'll come to the body temperature. Okay, let's talk about the ovulation part, and then we'll talk about the hormones also, hormone regulation part. So ovulation, what happens? I told you what happens is ovulation. When ovaries are releasing a mature egg that is ready for fertilization. Now let's talk about the corpus luteum, which is very important out here, because in this part what is happening is that This is the part which is occurring after the ovulation part, when the follicle is already ruptured. Okay, and um this repairs. Uh, you can say that this is occurring after the when the egg is not being fertilized. Okay, so after this breaks down, after this corpus luteum, when this breaks down, it forms the corpus albicans. Okay, so this is clear to you, because in this part the fertilization is not occurring, which is leading to formation of corpus albicans. So done. Okay, now coming to the body temperature part. The body temperature part is the time when the body is at rest. Okay, the body is at rest, the temperature is at rest, and it is taken when the person is sleeping. Before arising, it's taken, and it is this timing is used for identifying the time or presence of ovulation. Now we'll come to the hormonal part. If you see out here, the anterior pituitary hormones. Now, okay, I have not mentioned here, but I'll just tell you. So when there's a very important role for of hormones, okay, hormone regulation. See, the gonadotropin releasing hormone. Okay, what does it do is that this hormone, which is present in hypothalamus, it will stimulate the pituitary gland, anterior pituitary, to release two hormones known as the follicle stimulating hormone (FSH) and LH, luteinizing hormone. Okay, this FSH, follicle stimulating hormone, I did not mention to you this in my previous slide because I was waiting for this slide. Okay, do not confuse. Not confuse. I'll just show you. See, gonadotropin hormone. This will stimulate anterior pituitary. Okay, pituitary gland. Okay, anterior pituitary to produce two hormones. Okay, follicle stimulating hormone and luteinizing hormone. Okay, so now follicle stimulating hormone. What does it do? It will form the follicles. Okay, it will cause the follicles of the ovaries to grow. You can just say that it will help the growth of follicles. Follicle stimulating hormone. And what does luteinizing hormone do? It will trigger the ovulation. It will help in the ovulation process. It will lead to the ovulation process. Okay. So this is the function of the anterior pituitary hormones. Okay. You can see a diagram out here. Now, this part I've told you for the ovarian cycle. Now we'll talk about the uterine cycle. What happens in the uterine cycle? In uterine cycle, the process are just similar to the ovarian cycle, but the ovarian cycle is occurring in the um, ovary part where the egg is being produced, but and the uterine cycle is occurring in the uterus part where it is getting ready to receive the fertilized egg. Okay. So in uterus part also same in uterine cycle. First menses is occurring. That means menses means the menstruation part. Okay. You can see in this diagram. Just in the diagram out here. This diagram out here you can see the cells are totally thickened. Okay, the uterine wall is thickened. The blood vessels they are full of blood. Okay, they're totally thickened. And when they do not receive the fertilized egg, it starts to shed off. Or you can say slug off. Or you can also use the word of as ruptures. So this ruptures, and this is the also called as the follicular phase, or you can say this is the proliferative phase. Okay, the proliferative phase also, what happens after this is shed off, the ovary gets ready, and the ovary gets ready to produce the egg in the ovarian cycle, and again in the uterine cycle, uterine line again starts to develop. The layer starts to thicken slowly and slowly. They form the uterine layer, the endometrium lining. Okay, so this is occurring in the uterine cycle. So you can see in this follicular phase, or you can say proliferative phase, what happens? The follicles are growing. Okay, so then it's going moving on to the ovulation part. So when in the ovarian cycle, when ovulation is occurring, then what happens in the uterine cycle? What's happening in uterine cycle? This is a time when the fertilization is occurring. Okay, so now in luteal phase, what is happening is that in luteal phase, estrogen is getting the um, uterus ready to receive the fertilized egg. Okay, so when it is getting ready, so after it's getting ready, this is done. Estrogen is helping in the this one ovulation process. It's helping. Okay, now ovulation is done. So estrogen is helping in the ovulation process. It's done. and also the uterine layer is developed, and now comes the next hormone called as progesterone hormone. So this estrogen and progesterone, they are the hormones produced by the ovary, or you can say gonads. Okay, one of the gonads, because ovary and testes are two gonads. So in female we have the ovaries. So from ovary, these hormones are produced, estrogen and progesterone. So estrogen is helping in the ovulation, regulates ovulation, and also helps in the uterine lining development. And the progesterone, what does it do? It will prepare the lining of the uterine for implantation. Now, what is implantation? When an egg is fertilized, it moves down from the fallopian tube to the uterus part out here, where the lining has been prepared, and it will come there and it will attach itself to the lining, endometrium lining, and it will get implanted in that area, so that for the next steps to occur, like formation of placenta and all those steps. Okay, so that's called implantation. In the implantation step, progesterone is happening. Okay, now luteal phase is occurring. After the luteal phase, when it is seen that there is no fertilization occurring and the fertilized egg is not come for implantation, what will happen? The ovule, the egg is not utilized. So what will happen? Again, same thing. Uterine layer will start shedding off, blood vessels will rupture, blood will be released, and again menstruation will be occurring. So this you can see from the first till the end, and from the first of the period till the day before the start of the next period. This is the entire menstrual cycle. Okay. Now, during menstrual cycle, what are the changes that can be seen in a woman? So physical changes are there. You can see there's a tenderness and swelling of breast. Also, some women also have this diarrhea or constipation. Some have this gas or bloating. Some women face a lot of cramps in their uh, abdominal part. Okay, some have headaches, some have backaches. Also, some might feel fluid retention in the body. Some might feel very tired, vertigo issues, and also and they will always be feeling irritated. They will not like noise, they will not like light, and also some women also develop acne and pimples on their face. Okay, but if you see, as soon as the periods occur, the acne and the pimples disappear because the waste has, or you can say the blood has been shed, and now they're again fine. Okay, so in the physiological changes, when these things are occurring, it's obvious that a woman will feel irritated because the hormones are up and down, hormones are being released, and then also in the body a lot of things are occurring. The blood is being released, and also the linings are being broken off. Simple, when you see, when you have a cut or a wound in your body, you feel pain, right? And then you feel so irritated and don't like it. Imagine inside the stomach, or sorry, not stomach, inside the uterus of a woman, when the cells are being ruptured, or you can say when blood is being lost, or you know the cells are broken down. Just imagine how much pain a woman has to go through. So definitely, it will make a woman irritating. She will feel irritated. She will feel very. Sometimes she might feel depressed. Okay, she'll have a lot of mood swings. She will find difficulty in sleeping because of the cramps, because of the headache and the backaches, and she'll not be able to concentrate on her work, or she'll be always overthinking, and she might face anxiety and stress. And so please please think this to be a very sensitive stage in a woman's uh, life, because this is not something which is very easy. So a woman has to like go through a lot. So definitely it's a lot of physiological and hormonal um, changes occurring due to menstrual cycle, and therefore she is a bit she will feel moods have mood swings and all. So please bear with that, whoever has to bear with that. So now, what are the menstrual disorders? Let's talk about the menstrual disorders. So before menstruation occur, there are some women go through some premenstrual syndrome, because before the menstrual cycle occurs, there are some hormonal situations inside the body which leads to exhaustion. A woman might feel tired or irritated. So during that, what will help her is that she can exercise, or some food. She can have some healthy food. Okay, so healthy food is encouraged. Healthy food and exercise is encouraged, or to treat those syndrome. Okay, to treat the premenstrual syndrome. Number two is dysmenorrhea. What is dysmenorrhea? Some women have a lot of painful period. Okay, an unpleasant or painful period, as it is known as, because the uterus contracts a lot because of the loosening of the lining, because of the shedding of blood. So it becomes very painful for a woman. During that time, painkillers or oral contraceptive pills help as treatments. Also, there's another uh, situation known as the heavy menstrual bleeding. Some women shed a lot of blood during the menstrual cycle. It's also known as the menorrhagia. Okay, or you can say menorrhagia. So this, because of too much loss of blood, a woman might also develop anemia. Okay, where she has he does not have an adequate supply of blood, so due to too much loss of blood during menstrual cycle. So and this might develop if the situation is not controlled. Okay, if she's not treated well, then it might lead to anemia. Okay, so again, during this time, it can be controlled by using some oral contraceptives and also some hormonal intrauterine devices. Now, the next disorder is out here is amenorrhea. So, amenorrhea is that uh, situation when when menstruation is not occurring. So, some women might miss their periods not because of pregnancy, but also because um of other issues like hormonal issues. It might be some hormonal issues, or it might be because she's already pregnant, or maybe she's in a lactation period, or maybe she's undergoing puberty. Puberty is the time when a woman becomes mature. That means a time when she achieves the sexual maturity. Okay, she gets to the sexual maturity period. It's called a puberty period. So when a woman is in her puberty, or maybe she's lactating, or after the period is after menopause, okay, post menopause, but the last menopause, the periods which we see in a woman. So during those time, she might not have menstruation. Okay, that period is known as amenorrhea, when no menstrual phase is occurring. So again, this might also happen because of too much over exercising, or maybe gaining too much of weight, or losing too much of weight. So these things might also lead to amenorrhea. Okay, so these are all the menstrual disorders. So thank you so much for watching this video till the end, and do like, share, and subscribe my channel for more such videos. And if you have any doubts, you can comment on the below. Okay, and please do share with your friends, and be aware of it, of this condition in women, and be sympathetic, and be kind. Thank you so much for attending today's video. Thank you.